Hey, Dr. Shakib here from Irvine Spinal Wellness Center. Let's talk about knee pain. So stay tuned. Thanks for watching. Let's talk about knee pain here. In general, and I'm really trying to simplify this, but in general, if you have pain in front of your knee joint itself, chances are the posterior cruciate ligament is in pain or is hurt. Why posterior? Because the posterior ligament, cruciate ligament, really tries to prevent your knee joint or your femur over tibia from going too far back. Basically, that's the cruciate ligament, the forward-backward movement. So if it goes too far back, that's the posterior cruciate ligament. And if you have a front of the knee problem, it typically is a stretching of that. And then it depends on the extent of the pain and also other signs and symptoms that go with it. It's hard to, I don't want to make this a video about 100% this is what's going on, but basically that's a general rule of thumb, at least the direction that we can go. If is it the cruciate ligament, is it the collateral ligament, whatever the case may be. If it's pain in front, it's a posterior structure, it's a back structure. If the pain is in the back of the knee, it's typically the front structures that are hurt. If the inside of your knee is hurting, typically it's the outside structures that are not doing a good job stabilizing the knee and centrated and in place. And if the pain is on the outside, typically it's the inside of the knee structures that are being hurt. So that's essentially kind of a quick, really crude way of trying to give you an idea as to what part of your knee joint's hurting. A lot of times, because of the fact that we sit for an extended length of time, the hamstring and the quads are not in a good shape. When we're walking, we're not really aligned properly when it comes to the knee joint. A lot of people have foot issues because we're typically not walking like we should. We're just pretty much deteriorating in front of our computers. So I see unfortunately, a lot of knee issues in my practice. And this is not even in people who are, I don't know, involved in some kind of a sports and they hurt their knees. This is just an average person who just wakes up, goes to work, and maybe goes to the gym a few times. So it's not necessarily from a specific activity. It's essentially from failure of the posture leading to whatever the problems and the pains show up. Anyway, hope that this helped. If you like what you watch and you want to get more of these videos, subscribe to my YouTube channel. I typically put a couple of videos a week. And so if you subscribe, you'll get automatically notified. Essentially, the purpose of doing these things is for you to better understand your own body. If you understand it, hopefully you'll take better care of it. And of course, I'm here to answer any questions you may have. I'll make sure you have my contact information in the description box below. And so subscribe to my YouTube channel, follow me on my Facebook page, Irvine Spinal Wellness Center, where I typically interview the experts in the field. So this is usually a dual presentation and interview on a specific health related subject that you can only watch on Facebook. Anyway, thanks for watching. You take care.